talk, okay, to spend his time for our talk today. The title for his talk is High Resolution Ultrasound and Photoacoustic Imaging. Before I welcome Prof. Saijo to deliver his talk, maybe I can introduce a little bit the biography of Prof. Saijo. Okay, Prof. Yoshifumi Saijo received the MD and PhD degrees in 1988 and 1993 from Tohoku University. He had been trained as cardiologist in some hospitals in Sendai area. Okay, he became assistant professor of Institute of Development, Aging and Cancer, okay, IDAC, at Tohoku University in 1997. Okay, he became guest professor at Aarhus University, Denmark in 1999, and he became associate professor of IDAC at Tohoku University in 2004. Okay, he has been a full professor of the Biomedical Imaging Laboratory of the Graduate School of Biomedical Engineering at Tohoku University. Okay, he is concurrent with Graduate School of Medicine, IDAC, and Clinical Technology Department of University Hospital at Tohoku University. He has been director of Medical Device Innovation Center since 2014. He has been Deputy Director of Graduate School of Biomedical Engineering since 2020. Okay, quite new, recent. His main research interests include high-frequency biomedical ultrasound imaging, cardiovascular blood flow analysis, and photoacoustic imaging. His activity also include practical and interactive education of medical device innovation. Okay, so with this, now I welcome Prof. Yoshifumi Saijo to deliver his talk today. So I welcome Prof. Okay.
Thank you very much for your introduction, and thank you very much for giving me an opportunity to give a talk. This is my personal profile. So the important thing is I was working as a MD for maybe 10 years, and after that, I came to the university. Maybe most of you know the medical ultrasound imaging, but normally medical ultrasound imaging compared with an MRI CT is known as the easy, safe, portable, and inexpensive imaging modality. And this is one example of the abdominal ultrasound, and you can see the advanced hepatocellular carcinoma. And in this slide, you can see the movement of the heart. So now we can detect heart wall motion. And also using Doppler technology, we can detect the Doppler color flow. And of course, today, the ultrasound is frequently used in the obstetrics and gynecology, especially 3D ultrasound to see how the baby are moving in the mother. So medical ultrasound imaging is easy, safe, portable, inexpensive. But I want to say that's not all. Ultrasound imaging is multi-scale. So today, I will talk about the higher frequency ultrasound, obtain higher resolution ultrasound imaging. And this is a very simple principle. If we use the very low frequency ultrasound, at that time, the wavelength is inversely proportional to the frequency. And also the beam width is inversely proportional to the frequency. So if we use a very low frequency ultrasound and to look at this donut-like structure, maybe the result is something like this. But if we slightly increase the frequency, the result is something like this. And finally, if we use a very high frequency, result is like this. And this is very realistic to observe this material, this structure. So again, this is the graph showing the relationship between resolution and the ultrasound frequency. So these two equations. So simply speaking, if you increase the frequency, you can go the higher resolution. Higher resolution means the lower number, or anyway, you can get higher resolution. And in the several megahertz ultrasound, we have the echocardiography or abdominal ultrasound. And if we use the 7.5 to 12 or 13 megahertz ultrasound, we can visualize the carotid artery or muscle. And in clinics, we are using the 20 to 60 megahertz ultrasound for intravascular ultrasound or eye imaging. And above, so if we use the 100 megahertz, we can obtain the microscope imaging. And also, if we use 1 gigahertz ultrasound, we can visualize a single cell. And this is the easy comparison between the resolution and the ultrasonic frequency. In cardiologist, I was an interventional cardiologist doing the intravascular surgery. We frequently do the live demonstration. We are doing surgery, and the participants can see what we are doing, and also they can see the images of the intervention. And then during the intervention, we use intravascular ultrasound. We insert the small ultrasound sensor into the coronary artery and transmit the ultrasound and receive the ultrasound. So images are like this. And this is a conventional IVUS imaging, grayscale imaging, but we can see some structure in the vascular wall. And this is one example that surprised the cardiologist, clinical cardiologist. This is the angiography, and normally we say the patients, oh, this is the vessel, and the vessel is something like the road, and normally this is a very big road. The roads are very smooth. And if we just look at this angiography, this is very smooth. But if we observe here by intravascular ultrasound, this is normal, but this region has the atherosclerosis. So this I was finding surprised the clinical interventional cardiologist because we believed this is normal, but actually this is not normal. And also we can use this intravascular ultrasounds in the observation of the procedure of our, for example, this is coronary stenting. And here we can see the stent is not attached to the vascular wall. And we call this malapposition. And we can observe the space here. So we should dilate more. And here we believe we dilated enough, but actually this is inner vasculature, but this is outer lumen is larger. So we should expand more here. And here we observe the coronary dissection. Maybe we did too much. So now we can evaluate our stenting by intravascular ultrasound. And those are the clinical significance of the intravascular ultrasound. But maybe almost 20 years ago, I did the data acquisition for intravascular ultrasound and analyze the original ultrasound signal to get the newer image. For that, we have the intravascular ultrasound signal. This is the digitizer with the sampling rate of 400 megahertz, and this is the normal PC. And we also input the electrocardiogram and the blood pressure. And this is one example. Elasticity can be measured by the intravascular ultrasound. We can now we can measure the speed of here and here. And if we can get the difference of the expanding speed here, we can obtain the elasticity. And this is the one example of the IVAS-based estimation of the strain distribution. And actually, this is the international collaboration between Japan and Canada and Japan and France. And at that time, we could observe the strain distribution in the intravascular ultrasound. And after, during the procedure, we extracted the tissue here. So we can compare this modulogram and the tissue to confirm our calculation was correct. And this is another example. This is DCA, directional coronary atherectomy. Also, this is a cutting. We can extract the tissue by the cutter. And at the time, this higher strain goes lower. Again, this is very lower strain. So we can confirm this procedure reduces the strain of coronary artery. Actually, other thing is this is the original radio frequency signal of IVAS. Maybe some of you know the original signal like this. And we calculate the power spectrum with the autoregression method. The power spectrum is like this. And this is we call the midband fit, almost the slope of the whole frequency range. And this is a slope, and this is a frequency at the maximum power, and this is a frequency at the minimum power. So we characterized the power spectrum shape. And maybe we can say this kind of shape is a fibrous tissue, and this may be the fibrolipidic, and this is a calcium exhibiting a very high intensity. And also this is a calcified necrosis. And based on this spectrum analysis, this is our results of the tissue characterization. Yellow is lipid, and the green is fibrous, white is calcification. And this is the original IVAS image, and this is the integrated backscatter. This is a semi-quantification of the original IVAS intensity. And this is attenuation imaging, and this is a strain rate imaging, and this is our tissue characterization based on the power spectrum. And if you just see this IVAS, maybe you can see this is the inner lumen and this is outer lumen, just like that. But if you see the strain rate, oh, now this region is very soft. And if you see this is tissue characterization, oh, this region contains much lipids. That's why this is a very soft region. And normally in atherosclerosis, lipid-rich region is very dangerous. So now we can conclude, oh, this seems a normal atherosclerosis, but this contains much lipids, and this is a very dangerous plaque. So this is one application of the very high frequency ultrasound into clinic. And recently, we did the automatic tracing of intima and adventitia. And of course, very recently, you can use the machine learning or the artificial intelligence to characterize this spectrum shape. So we have not yet done yet, but this is very interesting for the characterization. And the next topic is the ultrasound microscope. And these are the three major objectives of the application of acoustic microscope, ultrasound microscope in medicine and biology. We started this project in maybe 30 years ago. And at that time, our application is for the easy observation of the tissue because acoustic microscope doesn't require the staining. But still, conventional acoustic microscope required the thin slicing. But recently, ultrasound impedance microscope doesn't need the thin slicing. But we started with the easy observation, but actually these are not so important. And very important objectives is to understand the clinical ultrasound image and to assess the biomechanics of the tissue. And if we compare the macroscopic clinical ultrasound image and the microscope, acoustic microscope ultrasound, we can get the origin of the echo. And also today, clinical application of the higher frequency ultrasound is available by IVAS or endoscopic US. And also the very basic study is the assessment of biomechanics, because we can obtain the microscopic biomechanics, and we believe we can get the novel diagnostic field using the assessment of biomechanics. And these are a little bit complicated equations. And if you are interested, I will give you these equations later. But the elasticity is obtained with this equation. And the very simple form, elasticity is proportional to the density of the tissue and the square of the sound speed of the tissue. And the viscosity is very, very complicated, but you can also get the viscosity from the measurement of the speed of sound. Yes. And now I will introduce what is the acoustic microscope. Actually, we use the transducer materials as zinc oxide until 1980 to 2001. And the central frequency was 170 megahertz. And that is a planar transducer with a sapphire lens, acoustic lens. And after 2001, the material changed to the PVDF-TRFE. This is a film. And the central frequency is 80 megahertz, and we use the concave transducer. But anyway, from the planar transducer, ultrasound is transmitted, and we can focus using the acoustic lens. And we can simply mechanically scan over the tissue to obtain this image. And this is the optical image, and this is the acoustic image of the sound speed. So now you can compare these two, and sometimes these are very comparable, very same, but sometimes they're different. And this is a case of the gastric cancer exhibiting very high sound speed. And high sound speed means the tissue is very stiff, hard. And this is another kind of signature cell carcinoma. Normally, this carcinoma is less differentiated, and the tissue is very soft. So exhibiting very low sound speed, that means that this region is very soft. And we can compare these acoustic parameters to the optical microscope images to get this. And this is normal. This is papillary adenocarcinoma. This is well differentiated tubular adenocarcinoma. So first, we wanted the data. Cancer is sound speed of cancer is higher than the normal, but we continued, and sometimes cancer exhibited lower sound speed than the normal tissue, and this should be reflecting the cellular differentiation of the cancer tissues. So this is a very new field, new thinking was occurred from the measurement of the acoustic parameters. And as I'm a cardiologist, I'm very interested in the atherosclerosis. And normally today, we believe the vulnerable plaque. This is a soft plaque containing the rich lipids, leads myocardial infarction. So risk of plaque disruption depends more on plaque composition and vulnerability than on the degree of stenosis. And this is Erling Falk, and he was in the Aarhus University in Denmark, and I visited him in 1997, 1999. And this is a stable plaque, and this is an unstable plaque. So lumen size is almost similar, but this contains the almost collagen fiber, very stable. But this contains a very much lipid, and this region is very, we call the shoulder of the atherosclerosis, fibrous cap, and this is very weakened and destructive. And this is a stable plaque with a thickened intima, showing the very high sound speed. And this is an unstable plaque with a weakened fibrous cap. In this case, the sound speed here is very low, indicating this is very soft and this is very weak. Actually, the sound speed here is 16 centimeter per second, and here is 15 meter per second. And these are the electron microscope findings. And in this region, the collagen bundle is very thick. But in these regions, collagen bundle is very thin. So we can estimate the very high structures by just measuring the ultrasound sound speed. And the Tohoku University is very proud of our collaboration in medicine and engineering. So we can make the high frequency ultrasound transducer in our laboratory. And again, this is the ultrasonic transducer, and this is the acoustic lens using the sapphire, and the electrode is gold, and like this. And this is the fabrication process of ultrasound transducer. Of course, this is the ultrasound transducer. We need to attach the electrodes, and that is something a little bit complicated process we need. And these are the vacuum system, and this was made in 1971. So most of you were not born at that time, and we are still using the very, very, very old machines. Well, anyway, we have some machines to fabricate the transducer in our building. So this is the apparatus outline of the ultrasound transducer. And these are the frequency responses: 80 megahertz, 160 megahertz, 250 megahertz, 300 megahertz. You can see the frequency getting higher and the pulse is sharpened. And these are the spectrum analysis. We can observe the 80 megahertz, 160 megahertz. Maybe we made the 250 megahertz, but the pulse response is central frequency was about 200 megahertz. And again, this time we made a 350 megahertz ultrasound transducer, but the frequency response is almost as 300 megahertz. And this is a comparison of the resolution. This is an image taken in 80 megahertz, and this is 160 megahertz, 250, and 300 megahertz. So the resolution is improved. So our idea is to use the higher frequency, we can get the cellular image. And we made the optical acoustical hybrid microscope. This was made by master course students. Yes, this is the optical acoustical hybrid microscope. Of course, in the optical part, we use the Olympus microscope, and this is the acoustic part, our handmade part. So the scan transducer is scanned here like this. And here we observe the C2C12 cells. This is a very interesting cell. So because if they have the original shape is a myoblast, and if they differentiate and fused, they became myotube. So the shape is very different from here to here. And this is a myoblast before differentiation. And this is the optical image, and this is the intensity image of acoustic microscope. And we can, from the sequence image, speculate impedance, density, bulk models. So we can measure the different parameters. And again, this is a myotube after differentiation. And this slide shows the change of mechanical properties during cell cooling. So we can observe the cell death, like, and in the process of cell death, these parameters change like this. So this is not complete, but now we have a very interesting tool to observe the mechanical properties during cell differentiation and also cell death. And from here, I would like to talk about the photoacoustic imaging, but maybe some of you have some questions. And if you have questions, I will accept this. Okay, can I continue?
Okay.
And I understand the Asian students, this is the same as in Japan.
Okay.
Maybe they don't ask too much questions.
Yeah. That's the nature of Malaysian student also. Not asking question much in the during class. So do you have any other questions? Any questions? Maybe you can ask Prof. Prof. Saijo. Do you understand? Ultrasound. This is about ultrasound imaging.
Yes. So I will continue to the photoacoustic imaging. Do you have some?
Yeah. Maybe Prof can proceed with the presentation.
Oh. Yes. So now from here I will talk about the photoacoustic imaging, and this is the combination of acoustic and optics. Because we investigated the tissue using the very high frequency ultrasound, we are very familiar to the photoacoustic imaging. And what is photoacoustic effect? This was discovered by Alexander Graham Bell, a very famous person, in 1880, almost 140 years ago. And at that time, this is a figure showing the method of producing sound by the action of an intermittent beam of light. And at that time, this is intermittent light, and they produce sound. This. And normally now I will explain the photoacoustic microscope. And there are mostly two modes. One is AR palm, and this is acoustic resolution photoacoustic microscope. And this is OR palm, and this is optical resolution photoacoustic microscope. And in AR palm, resolution depends on acoustic resolution. But if we use the higher frequency ultrasound, we can get a very detailed image of the tissue in the optical microscope resolution. But the resolution is almost 50 micron, but the penetration depth is up to 5 centimeters. Normally 2 or 3 millimeters, but in principle, the penetration is almost 5 centimeters. So laser is irradiated to the whole tissue. Then each targets makes some sound. And now this is a microphone, so we can obtain the photoacoustic signal by this. And talking about the OR palm, this is the optical resolution photoacoustic microscope. And in this case, resolution depends on optical resolution. And the resolution is almost 5 micrometers. And in this case, we irradiate the very focused laser to here, and if we get the some if we get some photoacoustic signal from here, and we can this detector doesn't know where this photoacoustic signal originated, but this laser know where to radiate the laser optics, so we can get the image. And this is a comparison of the penetration depth of the optical imaging. And this is a confocal microscope. And the almost penetration depth is almost 200 microns. And the two photon microscope enable the maybe 1.5 millimeter penetration depth. And this is OR palm, and this is AR palm, and this is a photoacoustic CT. Up to 7 centimeters is available in principle. And this is the prototype of the AR palm developed at Tohoku University. We use the diode laser, in which the wavelength is 532 nanometers. And the most important point is the pulse width. We need a very short pulse. This is 3.2 nanoseconds, but we need at least 50 nanoseconds. So unfortunately, you cannot get the photoacoustic signal by using the laser pointer. They are using the continuous wave. And the power is something like this, and repetition rate is 100 Hertz. And this is a concave ultrasound transducer. The material is PVDF film, and central frequency is 50 megahertz this time. And we put the hole here, and the diameter is 80, and the focal length is 50 millimeters, and the diameter of the hole is 1 millimeter. And we can put through the optical fiber here, and so now we can coaxially transmit the laser and receive the ultrasound. And this is the example of our photoacoustic prototype photoacoustic imaging of the nail bed. So this is a nail bed, and this is a nail, this is a skin, this is a bone. And in ultrasound imaging, you can get the image from the surface of the nail and also the bone surface, and you can get a signal from the skin. And in photoacoustic imaging, you can get the observation, you can get the blood flow imaging by photoacoustic imaging. Because in this case, we use 532 nanometer, and the 532 nanometer optics is mostly observed by the red blood cell. Then we can obtain the blood flow like this. So this is another strategy for our AR pump. Very different. Because this is a single transducer. This is a single transducer, but if we use multiple transducer like this, and you can see this radar parabolic antenna has a lot of detectors here. So if we make the same configuration, we can get the photoacoustic signal once and to observe the 3D structure. So this is the design of the 256 channel we call parabolic array transducer. And this is a distribution of the elements like this. and the size is 4 centimeters. And this is the 2D parabolic current transducer. You cannot see the 256 channels because we coated by the black color, but actually this has a 256 sensors. And this is an experimental setup. So first, of course, we started with air phantom, visualization of the air phantom. And this is a modified air phantom system for in vivo imaging. Again, we use the same transducer, and the laser spot is almost 1 centimeter. And we can get the photoacoustic signal from here. And this is ultrasound transmitter and receiver. And we can get the 256 channel ultrasound signal like this. So now we could successfully obtain the vasculature of the human palm. This is a 2 millimeter, 2 millimeter, 2 millimeter, and 2 millimeter. And the important thing is we can get the live image because we are analyzing 256 channels, and we can get we don't require the mechanical scanning, so we can get the live imaging. And here maybe you can see red blood cells are flowing in the very small vessel. And we can use the gold nanorod as a contrast for the photoacoustic signal. Professor Kodama, he is investigating the lymph node and the lymphatic vessel DDS. And this is the absorption, and this is the photoacoustic signal of the gold nanorod. So we can see the peak is almost 800 nanometers. And we injected the lymph node, this gold nanorod. And this is the optical imaging from inside, and this is a mirror image, and this is from surface. So this is the brain, but maybe you cannot see the lymphatic vessel, and from surface maybe you can see the vein, but you cannot of course see the lymphatic vessel. And this is a photoacoustic imaging, and changing the wavelengths of the laser. So using 800 megahertz, you can see the lymph, and using the almost now you can see the lymph, and using the 500 nanometers, you can see the vein. You can see lymph, and you can see vein in 400 to 600 wavelengths, and around 800, you can see the lymph node, lymphatic vessel. And this is our quite new photoacoustic microscope for the clinical investigation. This is 61 centimeters, 73 centimeter. So this is almost similar to the medical ultrasound. So we can easily get this machine to the bedside. And now we are using the 2 wavelengths laser. with the 532 and 556 nanometer laser. And this is a concept of the ultrasound photoacoustic microscope. And this is the skin. And the first 532 nanometer laser is irradiated. Next, 562. And then ultrasound. The next step, they have same two different wavelengths and ultrasound. And scan over the tissue, we can get a two-dimensional image, three-dimensional image. So this is how it works. We made a special cup containing the water, and the transducer is moving here to scan the skin over here. And we can easily get the images like this. And this is a specification of the system. We use the two wavelengths, and we use the less than 10 nanohertz. Repetition frequency is 2 kilohertz, and the intensity is something like this. And this is the maximum permissible exposure. And scan area and time is variable, and because we can change the scan step 15 micron and 30 micron. And one is a 6 and 3 millimeters. And at that time, if we use a 15 micron step, it takes 110 seconds. And if you use a 30 micron step, it takes 45 seconds. And in case 6 by 6 millimeters, using the 30 micrometer step, actually this image was taken by the 30 micrometer step. It takes almost 70 seconds, almost 1 minute, to visualize a 6 millimeter. And the 9 by 9 is at almost 2 minutes. And we also check the oxygen saturation. We compare the photoacoustic signal obtained with the 532 nanometers and 556 nanometers. And we validate it with the phantom, with the artery model and vein model. And artery model is made of the silicon tube filled of horse blood. And at that time, O2 saturation, oxygen saturation is approximately 100%. And this vein model of the using the reduction of the horse blood, and the oxygen saturation is approximately 0%. So we can get a very different color. Yes. And this is an in vivo validation. Again, this is a nail bed. And this is a CCD camera surface vessel. Oh, I'm sorry, again, this is Japanese. But you can get the vessel. And you can get the oxygen saturation. Yes. And here, this is the combination of the ultrasound and photoacoustic signals. And you can get the structure and the vessel structure in combination of the ultrasound and the photoacoustic microscope. The left side shows the ultrasound, right shows the photoacoustic signal of the. So now you can observe the blood cell surrounding the hair vessel, hair follicle here. So this is the examples of the oxygen saturation. This is a fingerprint. You can see the fingerprint, and also you can see the vessels beneath the skin surface. And this is a heel. So the thickness of the skin is very thick. And this is the cheek, facial, and this is the upper arm. And actually, a lot of cosmetic companies are interested in this technology. and they are very interested in the cheek vessel. And now they are comparing the vessel change between young and the older women. Finally, I will speak about a high-resolution photoacoustic microscope. Maybe this cannot be used in clinic because we irradiated the laser from the bottom and we get the signal from the top. From the bottom, we irradiated very, very focused laser and we get a very focused photoacoustic signal like this. And here we can scan the sample holder, XY piezo scanning stage. And this is a result of the red blood cell phantom. And but of course, some of you are very suspicious whether we can really get the image from the cell phantom. And this is a pink sphere, and the almost diameter is 10 micrometers. But maybe you maybe believe the resolution. This is a red blood cell of the bovine red blood cell. And normally the diameter is 6 or 7 microns. Bovine red blood cell is smaller than the human blood cell. And this is the blood cell imaging. So now you can see the very flat and saucer-like shape of the red blood cell. So in summary, high-resolution ultrasound imaging is available by using higher frequency ultrasound. And the photoacoustic imaging is an imaging modality to combine sound and light. And the photoacoustic imaging provides functional imaging because they very successfully obtain the tissue imaging and the vessel imaging. Thank you for your attention.
Okay, thank you, Saijo Sensei, for a very interesting talk, okay, today. So I would like to open a Q&A session to all participants. Maybe if you have a question, you can ask directly to Prof. Okay, I will open a Q&A session now.
Dr. Azian, I see there is some question on the chat.
Yeah.
Okay, maybe the student, the Malaysian student, quite shy to ask directly. They just they like to write question in
yes,
chat.
yes.
I just read the question, Prof.
Yeah.
Okay, I have one question. Okay, what is the function of water in photoacoustic?
Water. Yes.
Yeah.
That is a coupling medium between the ultrasound transducer and tissue. Because ultrasound is not so easily transmitted into air, we need some couplant.
Mm-hmm.
So
Okay.
we can use the echo gel instead of water.
Echo gel. Okay, so Nurul Ain, is it okay? Can you understand what Prof answering? Okay, so any other questions from students?
Hello.
Okay, can you introduce yourself first?
Hello. Hello, Prof.
Hello.
Okay.
Hello.
Can
you hear me?
Yeah. Hear you. Just ask directly. Ask the question.
Okay. Okay. My name is Dr. Sniza.
Okay. From?
My question from UniMAP.
Yeah.
Okay. Okay, and maybe you can ask.
Okay. My question is. what is the next or future focus in ultrasound research, especially in biomedical application? Is it designing a higher frequency transducer or anything else? Thank you.
Actually, I'm also investigating the blood flow imaging, and the ultrasound is going to higher frequency and also going to higher frame rate. And if we have the very high frame rate, we can easily detect the blood flow movement, two-dimensional or three-dimensional. And I believe compare with the MRI or CT, the most advantage of the ultrasound is the temporal and the spatial resolution. So I believe in next generation, one thing is to increase the frequency, and the other thing is to increase the frame rate to obtain the functional imaging. Thank you very much. Very nice question.
Yeah, very thank you, Dr. Hasniza. Okay, I open other participants. Maybe you want to ask Prof.
Yeah.
One or two more question, maybe, because
Yes.
we have another 5 minutes before 11.
Yes.
Maybe you.
I have hello, Prof. I have one question. Can you hear me?
Yes.
Uh,
Yes.
so
I will show you some example.
putus-putus ah.
Okay, Farah, you want to ask?
Yes, I want to ask question. Is it everyone can hear me?
Yes.
Uh,
Clearly.
I'm not sure if Prof can hear or not. Boleh. I have one question regarding the ultrasound. Can we use it to, because currently for boleh dengar ke Dr. Jan? Can you hear me?
Yes.
Clear.
Okay. Sorry, because at my side the sound is double. Okay. For those having a diabetic patient, they need to undergo hemodialysis, isn't it? So what I think the current problem is, there is a problem to find the suitable or the healthy arteries for the patient to insert the insertion for the tube. So can this technique, ultrasound, can be used to monitor which vein that healthy to be that suitable to insert the insertion for the tubing for the dialysis treatment?
Of course, there are some reports on the ultrasound measurement of the blood sugar, but I believe it's still in investigation process. So I think they can estimate the blood sugar is high or low, but they cannot get the actual absolute value of the blood sugar. But I believe that is, of course, everyone is targeting to measure the blood sugar. So I think the ultrasound has the potential. Yes, and I also have some questions. Yes, and one is very important. Yes, can I ask, you are using laser, which is a light wave, and how can it return to the sensor as sound wave? Yes, today I skipped the principle of the photoacoustic imaging. If you irradiate the laser to the phantom is heated. And if the phantom is heated, the phantom is expanded. And at that time, they produce the sound. Yes, that is a very easy principle of the photoacoustic imaging. So we transmit light and we receive sound. Yes, and also other question is a photoacoustic imaging friendly use for the hospitals, but this is now some clinical trials started. But one of the limitation is the laser. Normally, laser is very expensive, and that is one limitation. Of course, laser is irradiated within the safety range we can use in the clinic, but still the photoacoustic imaging is very, very expensive and limited. But I believe if we use the LED instead of laser, that is very friendly to the hospital, I think. Thank you. Good question. And,
Okay.
yes.
Any other question? Or maybe you can we can have a separate meeting later. Maybe if maybe some of the researchers are very interested with the ultrasound and photoacoustic imaging research. So maybe we can have a further discussion or collaboration in the future. Maybe, Prof.
Yes. Thank you.
Okay, because actually in UniMAP we are the lecturers or the researchers are coming from different background. Some of the researchers are doing the research in biomechanics, and some of the researchers doing in artificial intelligence and machine learning. So maybe we can collaborate in the future for this field, maybe biomechanics field or the artificial intelligence field part. That can fit into okay. So it's already 11 o'clock. So maybe Prof quite busy. So I think we can end this session. But before that, can we take a group photo for memories? Maybe
Yes, yes.
it's a screenshot photo. So maybe all the
Everyone,
participants
turn on the camera.
on the mic, on the camera. How to
What?
Ni kan grid view, right? Grid view.
Yes, grid view.
Share macam mana? Tak nak share. How can
So maybe Prof boleh unshare dulu, Azian.
Prof,
Maybe-
can you share the screen? Share content? Maybe Prof can unshare. Share. This is from Prof desktop. Okay. Boleh? Still share lagi kan?
Okay, nanti. Oh, this one Prof still share lagi, I think. Azan boleh, Azan as a host boleh unshare tak?
Cannot. I can share my content lah.
I think Dr. Ajin can share the screen, then the automatic will be unshared.
Okay.
Right. Okay.
Okay.
So now you see my screen, is it?
Yes, your screen.
Okay, how to
Then click button this one, show grid view.
show grid view? Okay, sekejap. Actually, I also not familiar with this. Share.
This one show grid view dekat Webex punya apps.
Webex. Ni kan?
Yes, Webex meeting.
Okay. And then open edit, share, view. Tak ada pun?
Yes. This one bawah ni. Klik icon tu.
Okay. I think I need to stop sharing, right? Stop sharing dulu.
Stop sharing, don't share your screen. Just view. No need to share the screen.
Okay.
Stop sharing.
At the top left,
okay.
top left have the
More people came.
Okay, everyone, can you turn on your camera? Just 5 seconds.
Azian, your camera? Okay.
Alright. Dia lambat.
Web screen.
Quite slow because Webex usually consume a lot of data and memory.
Oh, tak tahu.
Keluar apa?
Dah lah, everyone is.
Okay, Farah can take ni kot.
Ah, saya ke?
Boleh tak boleh?
Oh, okay, screen. Okay.
Because my view is not everyone.
Okay, I press screen.
Screen.
Okay.
Okay.
Tak ada.
Okay, so
Okay, thank you.
all right. Okay. So I think thank you everyone for your participation in this webinar from Prof. Saijo, okay, from Tohoku University. We are quite lucky to have Prof as our speaker for today. Yeah. It's very beneficial to the students, especially for a biomedical engineering student. Okay, and for all participants, okay, do not forget to fill up the attendance form so we can email your e-certificate after this. And to Saijo Sensei, okay, thank you for your time and your talk today. Maybe we can have further collaboration in the future.
Yeah, sure.
Okay, and so other participant, maybe you want to say a few words. Dr. Nash ke? Dr. Nashrul? Dr. Faizal?
Thank you, Prof.
Thank you. You're welcome.
Okay, thank you, Prof.
Okay, thank you,
Thank you.
Prof. And take care and stay safe.
Thank you, Prof.
Yeah, stay safe, everyone. Thank you for sharing your knowledge today.
Okay, make sure participant sign in the attendance for e-certificate.
Okay, terima kasih semua ya.
Okay, thank you
Okay,
all.
thank you.
Terima kasih Dr. Farah.
Okay, to Prof, maybe I will send you the certificate and also the letter, official letter to you after this. Okay, thank you. Okay,
Thank
bye
you.
everyone.
Bye.